Good morning. Um, it's a pleasure to be here. Thank you, Bayer, for hosting and being a supporter for so many years. My name is Felix. I'm the co-founder and CEO of Sanku. We work specifically in East Africa on a very specific problem, malnutrition, with a very specific solution, which is called food fortification. Fortifying food means literally making it stronger with proven science of vitamins and minerals. In fact, the majority of countries around the world have laws on the books that some staple food must be fortified, whether that's vitamin A going into edible oil, or iodized salt, or iron and folic acid and zinc in things like wheat flour and maize flour. So we work in the flour sector. We work with small and medium scale mills, not the large industrial mills. The issue with these laws is that they really blanket and cover essentially processed industrial foods, not the small scale food producers who arguably reach the most at-risk populations throughout East Africa. And so if you're a mother in a village in East Africa, most likely you're cooking this and your children are eating this. This is maize flour. It's made into a porridge with water. It's cheap because everywhere there's maize, it fills you up, but full bellies are not enough. And this is what causes what's called hidden hunger. It's not starvation. Your belly is full, but you're starving from the lack of vitamins and minerals critical for our growth, to build strong immune systems, high IQs, a better workforce, and literally save lives. So our job was, well, when we started 10 years ago, how do we get nutrients into people? Well, we have a great vehicle, literally a vehicle here that everybody eats. They eat a lot of it. It doesn't have the right nutrients. Well, then let's put them back into that food. Again, a proven science to save lives. So then we figured out, well, they're not buying this flour from a big supermarket or these big mills because they don't have a reach or a presence in the areas where these people live. They're buying it, and it's produced here at what's called a small scale hammer mill. Every village might have one, every town might have a dozen, cities have hundreds, but collectively these small mills literally feed entire nations. So again, a second aha moment. Not only do we have a great vehicle to get nutrients in the people, which is the flour, but now we know where it's being produced. So we thought, well, we just have to add a machine that automates the addition of these key concentrated vitamins and minerals into that flour. Nothing existed off the shelf, and so we invented one. And we invented this. This is called first the process of milling is quite simple. Raw grain goes into that small mill. It's ground up by the hammers or the blades, and out comes fortified flour. So we built this machine, which is called the Sanku dosifier, because it doses these key nutrients, and attaches as a one-size-fits-all on all of these mills throughout East Africa. And it adds a very precise amounts of nutrients, very safe. And because it's automated, it removes all chance of human error. We don't want that miller to do this very precise scientific job day on, day out. Naturally, he's not going to be able to do that, or she's not going to be able to do that consistently. So the machine does the job. The way it works is there's two compartments. The raw grain goes into one side and it's weighed, and the condensed nutrients, which is called a nutrient premix, goes into the front of the machine in very concentrated form. As that raw grain flows out into the mill to be milled into flour, those nutrients are precisely added and dosed as per the national standard to make sure people have their daily allowance of iron, zinc, folic acid, B12, vitamin A, all these things that we take for granted, which isn't there, which they traditionally don't have access to. Excuse me. And we know our machines work is because we installed about 8 years ago SIM cards in all of our machines. So all these mills were essentially online, speaking to the nearest cell tower. It's IoT. Back then we were very cool because that wasn't such a normal thing. Now everybody does it. I still think it's cool. And it's cool because in real time, anywhere across East Africa, we can see live on our phones, on our laptops, in real time where that mill is, how they're performing, how much flour they're producing, how much nutrients they're adding, if there's any technical issues like overheating, if a feed screw is jamming. All of those key metrics allow us to automate our team, we're about 100 staff, to drive there to fix, repair, or deliver nutrients so that miller can continue to do a critical job of fortifying their flour. We also in-housed a lot of the production of these key inputs the millers needs like the micronutrient premix. This photo doesn't do it justice, but this is our factory in Dar es Salaam where we're actually blending these nutrients locally, able to reduce our costs by 30%. And as a social innovation, a social enterprise nonprofit, we pass those savings on to our millers. And that means our millers are able to fortify flour and sell that at the cost of unfortified flour. reducing or neutralizing the cost of fortification for that miller, yet it's sustainable because they're still paying for it. We're just reducing the cost of the inputs. The biggest result of this is that in the marketplace, the cost of fortified flour is the same as unfortified. So a mother, for example, doesn't have to choose or make a hard choice to either eat healthy or send her daughter to school. We don't want to put a financial barrier to being healthy and to getting fortified flour. So this is a typical scene throughout Tanzania and Kenya where we work. There's bags of flour on the streets being sold that is fortified now. A miller has the working tools to do this critical job of fortification, and most importantly, a mother has access and can afford to eat fortified flour and be healthy, take that home to her family. Last year, or 2 years rather, in partnership with Bayer, we took our solution across the border from Tanzania and opened up Kenya as a country to start working with millers there. To date, we're working with 150 millers, and over that 2-year period, with the support of Bayer, we went from 0 people reached to 5 million people every single day now have guaranteed access to fortified flour. And we're not going to stop there. Collectively, we're already reaching about 10 million people, and we have the goal to reach 100 million people. And Monica talked about access to healthcare as a basic human right. We feel food and access to fortified food, nutritious food, is a basic human right deprived by many. And our mission is to bring that to 100 million people and guarantee that every meal consumed by every mother and child contains life-saving nutrients forever. That's our mission, that's our goal. Thank you very much. So I have the honor to introduce the next speaker. Hafsa Jamare is from the founder and CEO of Koamana, is a company dedicated to supporting farmers and small businesses with digital market access. Thank you very much. The floor is yours.
Hi, everyone. Hello, everyone. My name is Hafsa Jamare. I'm the CEO of a company that operates in Nigeria and Kenya called Koamana. But today I'm here to talk about the nexus of agriculture and health. And maybe before I just go straight into the slides, I want to say that health is actually something that I haven't really thought about for a long time. It's a relatively new thing that we've had to talk about in our business. Yesterday, I took a cab ride with Chitkala, and it was very interesting. We were talking about health and our reproductive health, and it's featuring in our everyday lives. It's something that it's not different in agriculture than everywhere else. I know that we've had, Monica was so kind enough to tell us about her experience. So health really features in every business. So I was saying, health is not really something that we've thought about for a long time, but I myself, in the agriculture food systems, I focus on market access for smallholder farmers. And one thing that people aren't aware of is that agriculture in Africa is comprised of all these sophisticated market hubs around the continent. And these hubs actually do a lot of agriculture trade. So farmers come to these hubs, they trade, and then goods move from one hub to another, and that's where the most of the trade happens. And what we do as Koamana is we help these hubs manage themselves. We enable trade between these hubs, we make them more efficient, and we introduce trade finance within these hubs and additional suppliers that could provide input, irrigation pumps, and whatnot. So we are a strong believer that existing systems need to be strengthened. We believe in the power of existing networks making what exists efficient. And so health has never featured in our conversation. We're in the business of trade, introducing suppliers to farmers and making systems more efficient, strengthen leadership and market hubs. But what happened was we introduced our debt financing product. And as we did that, we began to track the risks associated with trade. And we began to track why we had an exposure rate or a default rate in some of our loans. And we were able to look at some of the issues that were arising, like floods, goods in transit risks like accident. But one thing that featured a lot was health, something that we hadn't thought about before. And 27% of the incidences we were recording were women being sick, their children being sick, and then they're unable to pay or they end up with delayed payments. And that was really the beginning of us thinking about health. Before that, I think health was just, we live in Nigeria. The health system is bad. Every industry is exposed to that. So it was just the business of the day. But by the time we were able to quantify the losses associated with health, we were able to think about that a bit more seriously. So one thing we've done is, right now we have a project with Bayer, Advantage Africa, a number of partners on the ground, where we're trying to embed community health workers in the market hubs that we work with. We know that health is a big component in risk for a lot of the women traders we work with, and as well as on the farmers. So interestingly, is we're seeing a case on both the farmer and the trader side. So we have introduced Advantage, the community health workers, with Advantage Health. We really want to embed them into the market systems. We believe that really looking at healthcare as something that is exceptional, that's not a part of our everyday lives, is not possible. We want to see it as the general business of maintenance, of repair of humans. And so this is a new innovation for us. We've looked at agriculture insurance with Rose in terms of de-risking supply chains, but this, I believe, is something that people aren't really doing in the ag space. They're not looking at agriculture risk. And we believe that this is also going to become, over time, a major feature of agriculture, working with smallholder farmers, working with off-takers, buyers, logistics providers, all across the board. We've had incidences of people falling sick, not having access to good healthcare, healthcare advice, preventative health. So we believe that introducing this is going to be a major component of de-risking agriculture as well. It is not a separate thing. It is part of the fabric of everyday activity. I must apologize for these slides. I realize that things are showing up in random orders. But yeah, so the work we're doing currently in northern Nigeria, we believe with Abimbola and her team, we believe is going to be at the forefront of introducing something new, introducing agriculture and health as part of the same system. It is not different. It is fundamental to the system. And we look forward to sharing more of the results as we go along. And we look forward to also seeing the scale across Nigeria, not just Nigeria, to Kenya. So part of what we're looking at is really the business case for it. So the community health workers we're working with are people that earn an income. They're able to sell healthcare services to the women we work with at the market hubs. And we are building a sustainable model that can finance itself in the long run. And we're going to be sharing results as we go along. Thank you very much, everyone. I appreciate it. So I'd like to introduce Samuel Knaus. Samuel is based in Berlin, and he's a doctor. And he's also a serial entrepreneur. He's the CEO of Mtamadi and also the CEO of Lucid Social. They offer healthcare insurance to farmers in Africa. So.
Yeah, thank you. And I'm only the CEO of Elucid, so only one of them. And me and my co-founder, Julius, we are both medical doctors. So we have been working in global health for the last 15 years. So we are very much in touch and thinking about healthcare for the last 15 years. But what we have not talking and thinking that much about before we founded Elucid was actually trade. And what we do now with Elucid is providing access to healthcare for farming families working in global supply chains. So trade and global trade makes up a lot of our supply chain. More than 80% of the world's trade relies on global supply chains. And if you look at the beginning of many of these supply chains, it's smallholder farmers. But more than 90% of those that work in global supply chains don't have access to any sort of health financing and face major financial barriers in accessing healthcare. And that's not only a problem for the health, it leads to poor health, and it's not only a problem for the farmers because it also impacts the supply chains. It leads to reduced equity. It leads to a cycle of poverty when production reduces because of what Hamza just mentioned, because of just people can't work because they're falling ill. And this spurs this lower production and needing to gain funds for paying for care leads to the cycle of poverty. So our primary customers are not directly the smallholder farmers, but we work with other actors, with companies in global supply chains to help pay for the care and provide better access for these farming families. And what do these companies, and that's sourcing companies, that's chocolate manufacturers or coffee companies, why do they do that? Because we help them prove that they meet international and national compliance rules. We prove that the programs they fund have an impact on the productivity and on the livelihoods of the farmers they work with. And we make these impact claims auditable and communicatable for these companies so they can go out to the public and talk about this impact that they're having, the positive impact that they're having on the smallholder farmers in their supply chains, making supply chains more resilient and robust. So how do we do that? We use our own technology to work directly with healthcare providers in the countries that we work to allow farmers to go to these healthcare providers, receive care, healthcare providers file claims, and we pay them directly from the funds that we established with our clients. So that's focusing at the moment on essential and emergency care. And wherever there is a national health insurance, we work with these national health insurances to make sure everyone is part of this national health insurance, also strengthening the national systems. And by the direct connection we have with the healthcare providers, this allows us also to work directly with them to improve the quality of care they can provide. So what do our clients then get? So that's access to this data that we collect very granularly on every health transaction that happens. And we can calculate, anonymize and aggregate this data and calculate the impact this generates on the livelihood of the farmers. And our clients can use that for their own impact communication and also to measure how much the productivity in their supply chain has been increased. We also allow them to use our data portal for other sustainability projects that they can measure and display and share together. So one use case, and that's with one Swiss chocolate manufacturer. It's one of the largest B2B premium chocolate manufacturers in Switzerland called Feichlin. You might not know them, but you might know Springly. So they are producing this chocolate. And with them, we started in Ghana. We enrolled 8,000 farmers in the program, the entire Ghana supply chain. And what they've seen over the last 1.5 years we have been working with them is that the access to healthcare, the utilization of healthcare in these communities has significantly increased, but also the productivity in these communities has increased. And that's only one example of the work that we are doing. We are in Ghana, we are also in Madagascar, Ecuador, and Venezuela, and now starting in Uganda and Colombia later this year. And just recently, last week, we have signed with Tony Chocolonis in Amsterdam to enroll their entire Ghana supply chain in our programs to make sure that the farmers that produce this chocolate have access to healthcare. And we do this because health is a prerequisite for a good life, for all of us, for everyone in the global supply chains, but it's also a prerequisite for resilient and robust supply chains. So it really matters for us all. Thank you. And now it's my pleasure to introduce Olivia Elson. She's Associate Director within the Innovative Practice as Results for Development, and she's focusing on scaling innovations and strengthening innovation ecosystems. And here, amongst other things, she is part of the Secretariat for the International Development Innovation Alliance, and she also leads the Million Lives Collective. Please welcome her to the stage.
Thank you for the intro, and hi everybody. So yeah, my name is Liv. I'm going to be focusing my presentation today on the Million Lives Collective specifically. And I'll give a brief overview of the MLC for anyone who doesn't know about it, although actually many of the organizations in this room are members of the Million Lives Collective. And then I'm going to speak about a couple of projects that we've been running specifically with the Bayer Foundation with their support. So, what is the MLC? We're a global platform. We are all about catalyzing the scaling of proven, impactful innovations that are serving those living on less than $5.50 a day. We were launched in 2019, and we're a completely global program. We recognize innovations operating in any geography, any sector, as long as they're looking to serve those low-income populations. We currently have 116 members in the Million Lives Collective, and all of those have either already reached 1 million lives or are on track to reach that target within 18 months. So these are innovations that have really proven successful scaling pathways. It's run by a global secretariat, which is led by Results for Development. And we were really excited in the latter half of last year to launch our first regional hub for the MLC, which is in East Africa, and it's led by a consortium of 3 partners, Vilgro Africa, E&K Consulting, and Insight Health Advisors. So what do we do? 4 key things. So aggregate and verify innovations. As I said, part of our job is to find those innovations that are successfully scaling, and we coordinate an independent assessment of the impact. So these are verified innovations. We want to showcase the work of those innovators, and we try to do that through online platforms, through bringing innovators to events. Just recently, we were at Sankalp and the Kenya Innovation Week, to name a couple of examples. Learning is key to what we do at the Million Lives Collective. You can imagine with 116 members who have all done such amazing work, there's an enormous amount to learn from that network. And so part of our role is to try and encourage peer learning and exchange among our members, but also to produce global knowledge products. In a couple of months, we're going to be launching a new piece of research and a tool for innovators who are interested in scaling through the public sector. What are some of the enablers and barriers around scaling through government partnerships? And finally, connect. So part of our role is to bring innovators together with funders and other supporters who might be able to help catalyze their increased scale. And this is where our partnership with the Bayer Foundation really comes in. So in 2021, 2022, we were talking with the Bayer Foundation, and we came up with this concept of collaboration grants, right? What if you bring together these innovations that are in the Million Lives Collective, which have enormous amounts of knowledge, resources, networks that have successfully scaled, and you invite them to work together on solving a problem, either 2 Million Lives Collective members together or a Million Lives Collective member with an external partner. So our hypothesis was this could be a really, really good tool for exponentially scaling impact. We had our first round of this collaboration grant a couple of years ago, and we've subsequently launched a second round, which I'll talk about in a moment. And the focus of the Collaboration Grant Awards is to provide some grant funding, some technical assistance, and it's really all about learning about these collaborative models. Do they work? How can we learn about them quickly and iterate? We draw on some lean agile principles to support that process. Actually at this event in 2022, I launched the first Collaboration Grant Award, and so since then, we have been working with two fantastic organizations, Healthy Entrepreneurs and Restoring Vision, to run this first collaboration grant. The concept here was to bring Restoring Vision's expertise in eye screening and providing low-cost, affordable reading glasses and integrate that with Healthy Entrepreneurs' extensive network of community health workers. And we've been testing this model initially in Uganda, and I'm really excited that hot off the press, we have some results from an impact study which was done in partnership with 60 Decibels, who I think is also in this room. Hello. I'm going to read these off this bit of paper because I didn't even have time to put them on the slide. It's so recent. But there's some really, really promising results and super exciting. So we conducted some surveys with, I think, 200 and something customers of the eye screening and glasses. 80% of those customers are saying that they have increased independence as a result of having glasses. 96% report increased self-confidence as a result of having access to glasses. So these are huge improvements in quality of life. And really interestingly and really excitingly, 87% are saying that the glasses have improved their ability to work. This is key for us because we know that with glasses, individuals can actually improve their productivity and improve their earnings. There was recently a randomized control trial done by a similar intervention working in Bangladesh with low-income workers who, just with a pair of reading glasses, have increased their earnings by 33%. So these are super, super exciting results. I want to congratulate Healthy Entrepreneurs and Restoring Vision on these initial results. This is only after 3 months, by the way, of having distributed these glasses through a network. So you can imagine the potential for this expanding, the impact deepening, but also the potential for making these services and products available through the wider Healthy Entrepreneurs network. And then last year, we launched our second round of collaboration grants, a different focus this time, women's economic empowerment. So we went back out to the Million Lives Collective network and said, who has a concept that they want to test, a collaboration around improving women's incomes in sub-Saharan Africa. And these projects, we've selected 2 projects this time round. We're very, very excited. And I'm delighted, actually, that today is the first time we're sort of publicly announcing these projects. So I will invite some applause for our awardees, who are these 2 projects. We have 4 Life Solutions and Mandalay Yawanawake organization. They are collaborating to test a sales agent model for distribution of clean energy drinking water solutions. So 4 Life Solutions produces sour cans and sour bags which enable efficient sunlight purification of water. The idea is to combine this with the extensive network that Mandalay Yawanawake has. They're an organization focused on women's empowerment in Kenya. And they have a network of 4 million women, and we're going to be testing whether that can be a good distribution channel, improving the incomes of women who are distributing the sour cans and sour bags, but also obviously making access to clean water much more widespread in Kenya. And the second project which has been awarded is a partnership between Medic and D-Tree. Medic, as I'm sure many of you know, is a global non-profit which is working on strengthening health systems, and they are the technical steward and the core contributor to the Community Health Toolkit. The Community Health Toolkit is an open source, cost-effective digital public good which works to facilitate last mile delivery. And D-Tree is a digital health organization working in several countries across Africa. They are focusing on solutions to make health systems more accessible, personalized, and coordinated. And together, those organizations are going to be testing a collaborative model to enable digital payments to community health workers, payments that are more efficient and more accurate. So my time is very much up. I'm seeing a flashing timer. But I would really like to just emphasize the fantastic work that these organizations are on the brink of embarking on. We are really excited to be supporting them. And really excited to hopefully share some results of these projects at the next Bayer Foundation Social Innovation Day in a year or two's time. I think that all that remains to say is a huge thank you to the Bayer Foundation for facilitating this work. I also will say that all of the organizations that I've just mentioned, and I realize I've really just scratched the surface of what they're doing there, they're all going to be together in a workshop that's happening next on the agenda. Collaboration is key is the title of the workshop. In case you're interested, please head for that one. You'll be able to engage with all of those awardees and also hear more about their projects. And if you'd like to know more about the Million Lives Collective in general, then please speak to me or either of my colleagues, Anna and Jite, who will also hear from Results for Development. So with that, I will hand back over to Stefan, I believe. Thank you very much.